Good afternoon. I'm Dr. Dwayne Andrews. It's my pleasure to be here with you today, and I welcome all of you. And we are here to announce some important news for seniors in Oklahoma. And there are a few people I'd like to announce who are in the audience. There are many we could call out, but we will have to limit that to just a few. But these individuals have worked on behalf of their colleges or organizations. Melissa Kraft in the College of Nursing, Dr. Andrew Dentino, who is here, will speak. Dr. Rubenstein will speak, chairman of the department. Is Candace Shaw here? Candace is in telehealth area. Mark Stratton from the College of Pharmacy, and right here, yes. And Dr. Teasdale, who's in the audience also from Geriatrics Department. Also like to recognize Henry Hartzell from the State Health Department and Dr. Steve Ramirez, who's with the Variety Clinic here, Chief Medical Officer of that clinic here in Oklahoma City. So we're delighted that you could join us today. Let me share with you just a little information about why we think this announcement today is so important. There are 548,000 people in Oklahoma, and I'm one of them, who are over 65 years of age, and that number is growing pretty rapidly, as we know. The Centers for Disease Control and Prevention estimate that nearly 1 in 5 Americans will be over 65 by the year 2020. And seniors report, many of them, that they're not as healthy as they wish they could be. More than 30% say they are only in fair or poor health. More than half of the seniors have some form of arthritis. A fourth of them have diabetes. And more than 5 million Americans, unfortunately, have Alzheimer's disease. And that number, unfortunately, is expected to double over the next few decades. So it is a considerable problem that we face in the cognitive dysfunction area. So as the population of our state and our nation continues to age, it's vital that academic medical centers like ours take a leading role in advancing knowledge about the aging process, and especially the aging brain, and that we are involved in research-based treatment of health concerns that arise with advancing age. Today, I'm particularly pleased on behalf of the University of Oklahoma Health Sciences Center, the College of Medicine, and the Donald W. Reynolds Department of Geriatric Medicine to announce a new $11.5 million grant from the Donald W. Reynolds Foundation to further efforts to improve the health of seniors through the Oklahoma Healthy Aging Initiative. This is a senior health initiative of the OU College of Medicine's Department of Geriatric Medicine, and it focuses on enhancing the health and quality of life for Oklahoma's seniors. The Donald W. Reynolds Foundation has been a very valued ally in the development of geriatric education, geriatric research, and geriatric clinical care at this medical center since making their original gift many years ago that led us to form a Department of Geriatric Medicine. And we are extremely indebted to them for their continuing investment in what we do here and in the programs that are so important to our aging population. And I'd like to now introduce Dr. Lawrence Rubenstein, who is chairman of the Department of Geriatric Medicine and co-principal investigator of the Oklahoma Healthy Aging Initiative. Larry has done a magnificent job at coordinating the continuing development of the Department of Geriatric Medicine. I'm very pleased to have him come to the podium now. Dr. Rubenstein.
Thank you so much, Dr. Andrews, Provost, Dean Andrews. I'd like to begin by expressing my gratitude to the Donald W. Reynolds Foundation for its great support of our efforts to enhance the quality of life for seniors throughout our state of Oklahoma. Dr. Andrews just shared with you some important statistics. The fact is that we're all getting older, but we believe in healthy aging, healthy living as we age. That's our mission, and that's what the Oklahoma Healthy Aging Initiative, or as we fondly call it, the OHAI, is all about. Our goal is to support Oklahoma's seniors through a variety of programs that center on three key objectives. First is to increase senior and caregiver access to interprofessional geriatric care through partnerships with regional medical centers. Second is providing health education to consumers as well as to healthcare providers and families. And third is to optimize Oklahoma's current health and aging policy over the course of the program, which is really a long-term objective. The initiative is not quite 3 years old now, and already we've established important inroads as we work to improve senior health statewide. We've opened 3 regional centers of aging across Oklahoma, allowing us to serve seniors now in 47 of Oklahoma's 77 counties. These centers serve as hubs, providing both clinical care and health education to seniors in the region. First established was in Tulsa. The second was here in Oklahoma City at the Health Sciences Center, and the third in the city of Durant, or as they say, Durant. Already our programs reach more than half of Oklahoma seniors. Our educational and training programs are extremely popular. They're often booked months in advance. OHAI offers a variety of classes: Tai Chi, chronic disease, self-management, Eat Better, Move More programs are all quite popular. This new grant funds Phase 2 of the Oklahoma Healthy Aging Initiative by providing critical financial resources needed to expand and build upon our previous successes and to expand our reach to seniors in every Oklahoma county, including those living in areas of the state that have traditionally been underserved. Our last 2 regional centers in Lawton and Enid will serve the remaining 30 Oklahoma counties. And now I'd like to introduce my colleague, Dr. Andrew Dentino, to share a little bit more about what this new grant will allow us to do for Oklahoma seniors and their caregivers. Dr. Dentino is Vice Chair of the Reynolds Department of Geriatric Medicine, and he will serve as Director of the Oklahoma Healthy Aging Initiative under the new grant. So Andrew, please.
Provost Andrews, Dr. Rubenstein, others. Thanks. I'd also like to begin by thanking the Reynolds Foundation for their generous support of this initiative. With a 3-year, $11.5 million grant, we'll be able to expand our work as it's been begun in Phase 1. We'll be able to reach, as Dr. Rubenstein mentioned, already 3 centers established in the state. Adding 2 more in the southwestern and northwestern sectors of Oklahoma will allow us to reach seniors in every county of the state. Our educational and our clinical programs are very popular. We welcome the opportunity to do more. With this new grant, we'll be able to undertake educational activities for both seniors, the public, and for healthcare professionals. In fact, Dr. Teasdale, the Vice Chair for Education of the Department of Geriatric Medicine and principal on our grant, participated in a study looking at what elders need throughout the state. And with his team, they found that we need more senior health care givers. Our partnership with the OUHSC College of Nursing will be a focus of OHAI Phase 2 in the development of that workforce. The new grant allows us to develop certified home caregiver programs for all Oklahomans. It will increase the number of qualified caregivers in the home setting, in the workforce, but help equip other family members who may not acquire formal certification to perform those necessary tasks for their loved ones when they become caregivers for their own family or others. With this new grant, we'll also be able to continue work that we've already started to meet the needs and the interests of Oklahomans, as I say, from Altus to Miami, from Idabel to Boise City. It'll expand the geographic reach from the Panhandle to the southeast, to the northeast, to the Red River in the southwest. It'll increase the statewide awareness of geriatric health issues through professional and public and caregiver educational activities, and it will help train the next generation of healthcare providers for our older adults. Yet, also importantly, is the underserved areas, the pockets of diverse geographic and the diverse cultural fabrics of the state, whereby the partners in this program can then reach more and more Oklahomans. The funds necessary will allow linkage throughout the state of our endeavors here through OU Health Sciences Center and through our partners. How can we do this? We have staff that are throughout the room in many regions of the state who I'd like to recognize. Notwithstanding, this is a program of the Donald W. Reynolds Foundation in the Donald W. Reynolds Department of Geriatric Medicine at OUHSC College of Medicine. We have Ms. Jewel Oliver and Latrice to her side, others in my Dr. Diak, as well from representing the department, faculty, and staff. The OHAI partners in Oklahoma City, Ms. Claire Dowers-Nichols, Associate Director, Ms. Gail Sempner. Their own staff are here today. And from Tulsa, Ms. Linda Miller and staff. And here in Oklahoma City, Ms. Maggie Darcy and staff. And from Durant, Ms. Kathy Gooding and staff. We shall have additional 2 more teams with us in the next 3 years of this grant. I've spoken about our programs, but it's the people who tell the story best. People like Miss Mary Tomlin. Miss Mary's 70 years young. She's an accomplished quilter and very active spokesperson for her service organization, the Oklahoma Federation of Colored Women's Clubs, an organization which is 104 years young. Mary's the epitome of what we would say is lifelong health. Ms. Tomlin, would you please share some perspectives on what programs like this might mean to yourself and other older Oklahomans?
Thank you, Dr. Denenzo. It's a joy being a senior. I look forward to getting old when I was younger, because I look around and I would see people that at that time was twice my age that was really just moving right along. They had so much to share, so much to know, and so much to do. And I look forward to all of the possibilities that this grant is going to provide, where we will do better if we know better. So the educational part of informing seniors of what's necessary to stay young and active is available to us through this grant. The senior health center that I do go to when I think that I might need some encouragement, not no help, just some encouragement, is looking forward to being able to help us more. And it's really, I'm really delighted that this grant has been rendered to the seniors. We take care of the babies. Now we're going to take care of the seniors. Thank you.
Thank you, Ms. Tomlin. It's great to have you with us today, and thank you for those encouraging words. You know, recently I took my wife to buy a new computer. Hers was old and obsolete, and I had treated myself to a new one, so what was I going to do but get her a new one? And when we got home, it was a new Windows 8 computer, very confusing, and she went to the bookstore, came home with a book said Windows 8 for seniors. So it's pretty interesting how the concept of seniors seems to have permeated so much of our culture, and I think that's because we want thriving and vital and healthy and engaged seniors. So it's a delight to have you with us today to represent that group. Now, we are extremely grateful to the faculty and the staff of the Reynolds Department of Geriatric Medicine for their commitment and dedication to this initiative, but many others that are not being sung here today, and to their partners across the state. And so we would like to now take the opportunity to answer any questions either from the media or from members of the audience for a few moments. Are there any questions or comments that anyone would like to make? Teresa?
Well, this is a substantial grant, but we know statistically, as with so many other health markers, when it comes to our seniors, Oklahoma, we just don't rank really well in terms of senior health. And my question is, big grant, but what is it going to take for us to really do the job to help seniors turn those statistics around? And I defer to whoever is best to answer that question.
You want to tackle it, or you want me to?
Would you mind coming to the podium, because we do have some people watching on streaming and they can only hear through the microphone.
Well, I don't have a definitive answer, but I'll start, and others can chime in as well. But our plan, our goal is to do just that, is to improve statistics of the seniors, improve the health and the vitality. And it really is an incremental approach. It begins through increased awareness, increased education, and increased access to health care. It's really the approaches we take. And we think that with educational programs available to every county in the state, it will improve. People will improve their activity levels, their diets, their access to preventive health care as well as to the medical treatment. And I think my prediction is that we will keep moving up from 47 or 48th in the country each year. We'll be going a little bit higher. We've already, in the last couple of years, we've improved in a couple of measures, not the overall global health measure of seniors, but we've improved in some. And I think it's a matter of time until this is going to work. But it'll take leveraging our program with the state as well. The state has to start investing a little bit more of its resources in health care and human services than it has been traditionally. And I think that's also key. But we'll try to do our part, but other partners in the state need to also come up to the plate too.
I also think we need look no farther than this institution under the leadership of Provost Andrews, the Tulsa campus, which shall be growing, and the provision of a new generation of healthcare providers interprofessionally to care as a team for our older adults. So the educational mission is tandem gait, or lockstep, if you will, along with the educational mission of programs such as the OHAI.
I have one other question that I think the media might appreciate, because a lot of people gathered here are really familiar with OHAI, and I know a lot of the hands-on care is actually provided by family members or home health professionals. How is this program going to address those individuals and making sure that they have the training they need?
Thank you very much. One of the three main struts of this next phase of the OHAI, in addition to establishing the 5 geriatric centers throughout the state and increasing access to education and programs for the lay public, is the home caregiver piece in concert with our colleagues at the OU HSC College of Nursing, whereby families can participate in a 20-hour course, in-home care course, seek a special course in how to care in the home for their loved ones with Alzheimer's and other dementias, or a larger career ladder beginning, such as a CNA or other professional step forward for a home healthcare provider. So really, activities for anyone who, education as well as real practical skills for family members or others who'd be involved in the home care of persons with cognitive impairment or issues of aging in general.
I'd like to add a little bit, Teresa, to your first question. I think the caregiver question you brought is extraordinarily important, because for any elderly person, particularly if they're not extremely healthy, that becomes a major concern. And I think a lot of the healthcare reform changes that are taking place today are going to have to focus on the needs in the home as well as in facilities. Secondly, we're in a down period in research funding in the United States right now for biomedical research. We go through these cycles periodically. This one right now is a little darker and a little deeper and a little worse than many have been in my 40-plus years of being in academic medicine. That will reverse, but we're not sure when it will reverse. Eventually, more funds will be applied to research. I think philanthropy is now, such as the Reynolds Foundation, but other philanthropy is beginning to look at research as an approach. But Oklahoma, there are pockets of things such as the new senior wellness centers that are developing in Oklahoma City, some of the special programs being developed in Tulsa. Although the focus was originally on young people, I think there's also now a focus on our senior citizens there. It will take a little while for that to migrate throughout the state. At the end of the day, everything we need to do, unfortunately, comes down, in most instances, to the one question: how do we pay for it? And our country is struggling right now, as you know, and we all know, with health insurance reform, health care reform. How do we assess the value of certain treatments that we've thought were very valuable but are not, and are we going to be able to continue to do all these things? This so-called evidence-based medicine is an attempt to really bring a rational, cost-conscious, and a cost-effectiveness approach to healthcare. So I believe that the changes that you're asking about will not happen in the next 24 months. It's a multi-year process, but I think programs such as OHAI and some of the other partner programs they have can make a huge difference in getting this moving along and getting greater attention. Last thing is just the demographic impact of an aging population is going to force our politicians to sit up and pay attention. Most of them right now are really not in the senior group. There's not much institutional memory either in the legislature. But I think as they see the number of individuals who are healthy and aging and want to remain healthy, it's bound to have an impact. And seniors vote much better than youngers vote. So they vote. That's where their power is in the election area. Sorry for my little soapbox editorial, but I think that's also a factor in this. Are there other questions or other comments that anyone would like to make? Well, if not, we're delighted that you all could come to participate in this brief program celebrating this new grant. And thank you for your work, your participation. Thank you for your commitment to seeing that we have better health among our Oklahoma seniors and those across the nation, pardon me.
Thank you. Just